Celebrities who've admitted to having a cosmetic procedure. Perhaps the last greatest Hollywood taboo is celebrity plastic surgery. And for many years, stars have denied going under the knife, going under the needle. But times are changing, and a number of brave celebrities have opened up about their experiences, both good and bad, regarding plastic surgery and cosmetic injectables. My name is Dr. Julian De Silva. I'm a board-certified facial cosmetic surgeon, and my practice is in central London, Harley Street, and I specialize in only facial procedures. Today I'm going to be talking to you about Chrissy Teigen. Now, Chrissy Teigen, a very big celebrity, well, she's admitted to a number of facial procedures. She's admitted to buccal fat removal, which is removal of the fat in the lower third of the face that can give more definition. She's admitted having Botox, partly in the neck area, and that's sometimes called a Nefertiti lift, and what that will do is reduce bands in the neck, which are sometimes associated with the platysma muscle, or sometimes just because of thin skin and aging, and it can work well in early stages of neck aging. And then she's also admitted to having Botox for headaches, and migraines are a very common cause of headaches, and for many years Botox has been shown to be really excellent in subduing that type of headache and can be effectively used even long term. She has denied having fillers. So if we've got this kind of before photograph and after photograph, and we can see there are quite a few considerable changes in her face. In terms of volume, well, she has more definition in the cheek area, and she has dimples, but this definition is exactly where the buccal fat lies. So some people have got wider faces to reduce the width of the face and give more definition, particularly if you've got a more puffy, round face. The buccal fat reduction can really add definition. And generally speaking, we never want to remove all of the buccal fat. We just want to shape and reduce it, because that will give a natural definition. In terms of aging, well, we all lose natural fat with time, so you never want to remove a lot of fat from the face, because with aging that will change. Her chin is much more V-shaped than it used to be. It's much rounder before, and now it's very much more V-shaped. Now, she's denied having fillers, and another way this area can be augmented is with a chin implant, and it would be key that that chin implant is tailored to that jawline. So personally, I shape each individual implant in order to create the different appearance of the chin. So to create a more V-shaped chin, it means sculpting the implant to match that person's jawline and what they'd like to achieve. This can be achieved with fillers temporarily, but often it's quite difficult to get that sharp definition, because fillers tend to be soft and gel-like, made out of hyaluronic acid, and that gel is more difficult to give definition to. And also, looking at her brows, it looks like there might be just a subtle change in the brow. The temporal brow area just looks that little bit more lifted in the after photograph, and that can come about with a little bit of Botox. But a common procedure is a temporal brow lift, where there are no visible scars, the incision is made within the hair, no hair is removed at any time, but what that will do is just lift the tail of the brow very slightly and give a more arched appearance. So in conclusion, well, Chrissy has admitted to having certain facial procedures, buccal fat reduction, Botox, but there seem to be a few other changes as well, and very much it's a refinement. You know, she's a beautiful woman, she looks beautiful both before and after, but she just has that bit more definition in the lower part of her face. The jawline, the chin area looks more defined, the cheek area has more definition, and possibly the brow lift has changed. Either way, she looks great. I have completed all of these facial procedures for some of my patients, sometimes in terms of fine improvements and refinement, beautifying the face, sometimes because it's been an area like having a recessed chin. Well, that can be something that many people really notice for a long period, but we can augment that. And with good surgery and refinement, often things look natural, and so it can be hard to tell whether someone's really had surgery. I do hope this has been interesting for you. Thank you for following this video, and I look forward to seeing the future. Thank you.